Welcome to this new episode on Zone 5 Health Line. Yes, we did say you are yearning, say Abribia and Mubati and Ka, and when you those content, you know. We did say you are learning gradually from this big family who share from Zone 5 Health Line. And then, yes, we have to your own son day. You very near ye ni, none dear won't say, and then dear Apomodum Selma and dear Atro. And then you know correct and some mistakes in your no e be kire ye send ya won so obenyanti ase abrebi a woko health facility biara no the baby and so obenya fair idea about bibi biara ekoso in a hospital setting or healthcare delivery no obeti bibia ase it is Zone 5 there obeka family a ese wutua de na okaya bibi biara ye ko biara no and then so ye da so kwan erade nyankopon aye e Zone 5 health line so and adwumadie no yes from con a topic and so over like him jere say when be ji pa enne the other punti so person ote na person hu so e be twa ye ho akwaba na ye koba osonfo Richmond tete madam guest edi ye den edi wi a na the topic a other point no ene so aka ho kan ho abra ye twa ye ho aba no Isama wakwa say ojere mere etwen me abra me twa me ho ekobae no ene said American akachro no ye wo sweet roses wa wo hwe praises place aye we fefe ne bia fefe ya have program ya wa me jere say wani kan ye pa ya inside nwa junction mo aye specifically sweet roses so oba ha aduane drinks are drinks. What the bra na the family no mon pass by na mo hwade na wo wankasa obedi adanse e na say da medi kan ka chiro no ya bekasa afa topic bia ya to need waist pain ya cause waist pain ya other pains kakra be chepo afemu e bia no ti pain how do you manage pain ana pain bia na e pain ana meti bia say mitumrika ekwa yarasa bia na e den na se me wenti and I was on 5 hours like Yakope obi a onim te pa onipa na ye be introduce no me jeri se na share show no so pen onim ne so be de onipa we be enche ne be bon apinity awa na wada ne ho adi me jeri se obenim no we de sama wakwaba the other time you gave us a very innovative explanation and vivid explanation on stroke we de in the other point another point so waist pain any other
me chia we tie for no wahwefo yina
that's
okay so you can say waist pain so can say be a ma explanation and I say the meaning of waist pain aya yintini nya baby pote because and to say stroke na no me betina ha me twa me ma definition because of waist pain is a broad thing and I fa na wahalo. So what you say? Into any pain, dear, what's no fiti, which is so ever for.
They have for me example.
Which has say no ever for me and they classify no as waist pain, but say it was one. You know, there was a friend waist pain, and in the end you can say friend waist pain.
Into say a cancer waist pain, dear. Share for so we share machiha anamba josesa mechia kusi misisi hwie ka no sisi no me ko achi
so yeah enye waist yes waist
okay it's a fa
so wa ha de say ye fa na ha ne
cervical
okay e ka se me kon achi iti misisi achi
ti
wa ha no
me ha
kosi usisi
line no na ye waist pain no oh okay nti wa hwani ya oha wase oha akosi usisi achi line no eho ene ye fe no waist pain no okay why that particular place
Only you choose the topic waist pain because Ghanaians or Africans, and I said the whole world, people assume that any pain we are betting on which we are used to see area.
Okay.
That's why, yeah, that's why you're choosing the topic waist pain. But any BB waist pain.
Okay, I remember.
I think the correct English for us to use is back pain.
Back pain?
Yes, not waist pain. Because waist pain, that means we chinka say no, ehone eyo yankwa. But be how say me ti ya only free me chi ha. Nti se ka back pain na include hanging na me tin wo ma ha kosi Mrs. Line mo so o ka say me chi me when you be decide you say is it upper back pain or lower
back pain? In the viewers you be a lot of demonstrations say dem where there obehu nyama yie pa na obehu sumi a me yenkofo bia me na obehu sumi ay example no eti twen wani abro hwe no o kire waist pain me dan me ho na wa kire oyi nti obe kire say the right way to be used is what? Back pain. It is a fit me hefa.
Okay. Ti yeah say obika say na chi eye ne ya onka say bia na chi sro.
Okay.
Ana na chi form ana na chi mfimfia na ye ne ya ti wa classify say na chi eye den eye ne ya nti ono na ye be busa say na chi na ye ne ya hefa pote ene ye ne ya oh ene me ti ya ho ni free my ha side me ehun say no ne upper back pain ana say me ti no ha na eno e che say ye hu say eno ne lower back pain.
Okay, so the specific place that only pa be Filipino and I'm the classify no.
Yes.
Okay. And then what is that back pain in general?
All right, so obi back yasue
okay.
Say the chi ene ya aje where they ask me right into how to diagnose it early because I was saying no starting before the whole show. The reason being that until we've seen an X-ray, we can't determine say NAU. Because so far back pain, we have lumbar spondylosis.
Okay.
We have lumbar spondylolisthesis.
Okay.
We have bone spur. We have a lot.
And that worse and more you kakra. More fancha.
Yeah. Say you can lumbar spondylosis send you be ya hwe for betia se and say enu when there is a degenerative of the disc. So what you say yeah okay yen fa mo bra anatomy mu kakra na say ye chinka say no won say ye chinka say no nyame e boy in a way say don't paint ni hia.
Oh okay.
Minim say won ho
my ho pa
joint bi e woni pede ni mu bia no
bibi shentem
bi a shentem send ye be ya head don't paint dey in share because on say baby a joint e will be ano and na boy am yetimi movie and the more you movie no na say don't penny don't patient na etwitwi ne ho a e be den e be re etinga me de ayi na e hye mfimfii no e de to wo send ye be ya don't penny entimi nye den in share send ye wo yekoto dwem e wo your friend is say ya bas ya betty any your 9 coco ni baby and where we find joint in no the same applies to your chinka say no so o share spine na your chidompe na in between spine ni bia no nyame de bibi atum finfin
ho
atum finfin send ye be ya your chinka say no enye den enhia but enyini nti no unyini ana de maden erere
sa we ne dantem na erere
and now so say your activity be to make Kenya no ema etimi erere entem o say nipa de wu nyina niema bi esoti e we nipa duanim but we o ha ne niema bi a oye ema estate entem
erere entem
enti sa de no estate bi a eno na ye spondylosis no
nti say sa ade na ededa dompe ni ntemu no esa asese erere a ene ni spondylosis no oh okay
ena you can say back pain eye bebre you will want to say ade we very common I mean say ahwefo person omote but a topic on it won't dafo from ye be kasa eno ni sciatica incofo e be friend sciatica e be friend ba ye dey friend sciatica
wow sciatica me da se panse wa boso e be nyamre panse ya kan ni akom cause one of the causes are me say
amanfo ntia se ba wotidi ni pa se ne nam mframa
ade baako I no so ne course den ewo ho I no so come back pain ho eno ne ye se yentini na nenam ye nipadua nenam ye chinkase ni mu no on se wo hwa wo hwe dompani ya ayi bi ewo ho ye suban bi anase ye ne ye bi a ye betimi ama ebe chia
okay
chia free ho a when he say Yankopon ambo nipadua ne se bibia wo baby for a reason or for a purpose
okay
the entire Yankopon man here in a way as a C shape ne say it has its purpose maybe I say yeah that dwumedi aye din that's our daily activities bi ko ka ho ma eco shift ya it me koto nerves ni bi so and na wonim say intini so no eninam nipadua ni mu and na ye chi say wo ho obenya your friend is say chinkasa ho chima na eka c6 na
okay
say nipa no omase adwodwo efri say nerves na ewo ho no enne connect eba ye nam say what you say it is say eco shift na ekoto so a the pressure egu sa nerves ne den eso enti eno no mo ye mo say na chi eye mia na efa me nan mu ekosi me na ase no eno ne sciatica no enti na make us say you can't back pain na ya mana ye kese because we have like it goes beyond that back pain I had yeah no it's say make your spondylolisthesis you will bones fair obi o ha wo be wo no na don penny be afifi ewo eno in e be normal obi open so abetimi akwakoji ni nyina ejina wa
afifi star
oh and no the tell say e bi nyini ewo ho ena nye ye chinkase nkwan so na etesi etobo ha ye nantiri ho no don penny bitimi efifi ewo and I say one who be obi o ha even our normal humans here na obi anensa ebitimi fifi wo and check ti sa information etimi ba at any time
okay
ti say can say waist pain na bebre ba yen famra lumbar spondylosis
lumbar spondylosis
because and only a very common Monday amekọ adwuma kwesi Friday say me patients 10 na imu 9 lumbar spondylosis emu ba ko pen of body different case
patient na can let's say you inform patient be client na wo ba won chen no for to see you as a physiotherapist no
out of the 9 clients 10 clients 9
lumbar
spondylosis
okay before you move because I like many viewers many energy no and then how the education is going on. I love it very much because this is one of the daily activities and that is what Zone 5 Health like want to put it out for people so that sa idea no. Before you start with that lumbar spondylosis, can you teach us what the lumbar is? Where can we find the lumbar?
Oh, okay. So spine no. Okay. Cervical eno na wo
yenkon achi pa
na ya ba thoracic no me aba lumbar me coccygeal sacral and blah blah
okay
lumbar ne wo ase ye chi mfimfin honum kakra
okay
eho na lumbar
ne wo
ewo it's that side na you find the lumbar spine. Yes, that's where we find it.
Okay, so that is the place ye chi infin no kakra and ye hu lumbar no and a lumbar no ya chi chema na
ye wo mu bebre
okay
ye wo mu bebre ye wo L5 ekwa se ne eka no e fiti spine ni na 32.
Oh okay
what 32 and a B a 5 a B a 7 a B so enti say anything I make her say you can see komwa and we are going to teach about spine but the enemy say lumbar no side no and the most common people are going through.
Okay so then let's dive inside and yanko
so send na make sure you move on lumbar no mum the most common type of waist back pain back pain yenya ewo yaso
and then viewers take note. We say you can't talk when say waist pain, but he said medical they are nipa referring to waist pain here, most especially back pain. And I fan say they are the waist pain. They also misses you, but you the exact thing or change the back pain rather. Okay.
So as I was talking, you know, Inti, I was about your swear, and you who at the copotia. And you'll say, is it the cartilage in the air wear off? That's the degenerating. No?
Okay.
And when the air wear off, and now say, pressure being a good nerves and so. And now say, like, don't pay me the one touchima until you walk into our department for us to do further assessment and all that. No, you intimate and fear and can say, Miss CC, me, it's me, CC, area drew. Yes, that's how it is. So, we will talk much about the lumbar spondylosis because that's the most common type of back pain that we are having right now in this generation of ours.
So, lumbar spondylosis is one of the leading pains in our society or in our setting right now. Okay, then what is besides then the lumbar spondylosis now? I will show you kakranti.
So you explain here. You better say age-related issues.
Okay.
So what I say because we assume or scientifically when you say near, and then what say they eba, and I make sure say lumbar spondylosis near say mean cabet me abwa mchina cartilage no.
What the bone cartilage is na
cartilage na that in between your spine no.
Even your friend your veins and your intini.
Something like that.
Intini. Into okoto na ntwikura na o se gigi intinti mi dindimi. And any cartilages no. But veins, some veins and so sa intinti no se na dempa and ho asam na oka no. Aha. And your friend cartilages.
And no start to say and no na best start to feel pain no.
The other that lumbar no in between no and area and nya sa lumbar spondylosis no. No, okay.
Hence and lumbar spondylosis. So say lumbar spondylosis in so who is a age related issue.
Okay.
But senior say can because of our activities in things. Say age view bet me nya akola or 16, 17 no lumbar spondylosis.
So at first the risk those people who are exposed anganas no anka nipa anka betumi tanya pa ye nyini na anka betumi nya but say there obia betumi anya bi. Then what are the activities that may aye betumi lead into lumbar spondylosis?
Be brave for lumbar spondylosis they be brave.
Okay, be the
same. We should start from Nkora.
Okay.
Accra go school and the bag na ebo lechi no. Books be all subjects egum. Na
Auntie Portia, for some mame. I said today we are going to learn. You see, these people are the unsung heroes. That's what I call them in a hospital setting. But ye face be and I open him, but no, but health in zone 5 health like yes, hey, we health promotion, you be disease control officer, or beba, we wine. You be your beer, near but sere nyamapa, or be a PFV. School bag and cabba for it today, and go with Madame Bianco. And then she had.
Okay, so I collect school. Books be brave, Monday to Friday books in every bargaining. And yes, sir, washer and the post channels, sir.
Yeah.
Only new connect chaff in what anymore. And one thing is, I did a spine or penny say, Obessa son, the posture.
Okay.
And it doesn't take just a day or yet to so, and a spine. And I say a straightina. And you one day, a young kakran, a bit me take you bear 40 years. And sana, a who's so solo, a daddy. And Carabisano, a young your friend is saying, Lord in the door so, a will on my chido. Or toss so cost sa, a bedroom baby no, near the problem. Abba, the cheek. And no ne idea about one color, a tie, a more munya condition, young famba. Young ladies, over your office, Ejuma.
Okay.
Or mostly no one a laptop so. The prescribed chair, I was saying quarter so no you. The sofa be more leaning on it no a chair who bear 5 hours or a chair who's a type here. We are called that.
The sofa no leaning
or leaning or chair who's style be no them not or type it.
Or type the typing posture. Where the young woman suit our jano aso na intelligent ba. Our activities are no eba. Enyina ha ye wo misuti awa ye ntwa ye homra ye ba ye de ye won so beto aso. December makwaba ebio eba zone 5 health line. So and then so already adom you discuss about waist pain, back pain, about specifically said the OD kama you know we are stressing or we are focusing on lumbar spondylosis. Say your chin kasa ni bi one the other that's no say real sa problem na de maye no and na you focus much on because eno na nipa bebre a problem a nipa bebre ekom na ye ne your sister or your physiotherapist Portia amo and na ye ne no atwetwe nkomo no and then say said ye di kan no fire naba e mo chire activities nyama ye ya there is our pain we they say anka first na anka mpinifu na enya ba say akola akora na o se misisi ma mechi eme ya e no o kire say the awofo enyina ni beda ho no we dey na me san kai will be say baby a settings are uhu ye wo sweet roses nice place sweet roses e wo nuwa junction more ba ha dia aduan ya wo pe Chinese food na pa benya pe look assorted rice nso a obenya wo pe smoothies and drinks and so nsa ebeka we dey yento ankomo twetwe ne so ante Portia na oka about the exercise and the activities yeah tumi nya sa lumbar spondylosis no enti yento aso na oka about typing answer na
so that's ningina fall under poor posture
okay.
Or assuming some position be what so far not tenim now I type the aye the be about 5 hours sorry.
So what are some of the poses? Can you show us some poses?
For now they mean to me, but you know under normal circumstance, what can I say? Also back A straight.
Say
the way I'm sitting.
Say I would take.
Also back A straight. Say mostly ni you come here you use it around us no. And you need no back support. I'll be to me.
Support on say.
Okay. Until at least you have to be straight. Akonya na oyede. Uti ba ono wa chia no ho style be say. And all that akonya nim. Or feel comfortable. Say I say you be feel comfortable. You be type it.
Na go on so obi so yes not the type.
Not or type.
Oh okay.
And only idea back. And another thing is so one nam e krom na wo ba to me hu obi no asesa bayre egu ne nsa so ne ne kon ho. Bebre no oton wadane body no store and was saving a lot of products on it and oton nam what the pressure egu ne chinka say so
sir
or the pressure egu ne chinka because they be how carry by rebe 10 negu wabeti meaning say what who say dey no street ni ma egugu omo nsa na be gugu omo ha no mo de nam and na so obi o carry heavy loads also pan kese akola kitwa na also pan kese na nsuo no or the pressure egu you know so and na ahwase na make asa me try mu say spondylosis ni say ye chi the cartilage in between the spine is starting wear off. So imagine say ye chinka say near the cartilage in the wall and fin say and now what the pressure egu wa hani say ade na eye e force miano
e kan bom say
it yama say what say winyini na like winyini moma na erere no because of pressure na egu so ninti no e be start aye dey awewe intent. So it's all part of the posture, poor posture, carrying of heavy loads. And you can say or drive a check.
Driving.
Or tenacity check. Or betting at tenacity the whole day. Oh sorry. Akunyano so tenacity no. Enye. All those sorts akunya so straight in the whole akaba akunya no enye. And now when you sit upright like this, it will get to a point obebre. Obebre into ningina eka home be
into which means that your specific standard of chairs I say at national offices and
yes
so be eba and obi contact mo physiotherapist and to match on
cha o use
I say we use one office it's any chair be and to use one office
no say oh using any other chair either say you are using the chair for a short period of time.
Okay.
It's not like betina so I chose the office for no. They spend like 8 hours at the office. It's who command on this chair or the chair that you are sitting on. What could you pano? She has to get a correct chair. Send it by your bed or betina so you feel comfortable. We have plenty chairs are designing like a spine to support it.
Okay.
So that's the prescribed one for us.
Yeah, chairs are designing as a spine. No?
Yeah, as a spine.
And they prescribe for what tenacity chair.
Yes. So these are many more and a course.
I want us to bring more of those activities because it's very key. Society. I want us to bring more.
Sitting for long.
Okay.
Is one of the major causes. Poor posture.
Okay.
Obi to me we no back pain because of say onyem no the posture that she assume. Say the chest no eba no why you say. Obi ho wo mi on to me corrected that posture ni bio. And I was saying sense for 9 months. It's been like this for 9 months no. You feel that pain. Sometimes obi walk around we near 3 months, 6 months, then she starts feeling the pain.
So one year na okoro so wa sha say obi tumi ku anemu obi tumi affect no
and also affect say back pain, sitting for long, poor posture, and many more. And you know back pain. Because if I want to pinpoint our daily activities or our lifestyle, I think I fall under poor posture. Yes, I think I fall under poor posture.
So it's only when we talk about the lumbar spondylosis now, it's only poor posture and the banner.
Most of them need a poor posture.
Then what are the other?
Maybe was spine problem, not quite surgery.
Okay.
And also to me the other and American pregnancy.
And also to me
and also to me
and even accidents
into me the a whole lot. But I think enough falling. Over pregnancy, say I still falls under poor posture. Because while you me a wrong posture, accident is so to me, and any accident as a car accident. You can fall, like committing a fall be or is a dangerous fall than accident. So so to me from maybe a problem at the toichi and casino. The accident in so it's me at the back.
And said I watch say lumbar spondylosis no and as sa nkasene we yachina we na rere no enti se rere mutum ni bibi hye ho ana mo ye ne say
it depends on how early I'll be visited with doctor.
Oh, okay.
Once right now you don't know say we chinka say be rere obi ho to meet na wa. That reminds me, I always use my clients because
that's what yes.
I had a client last 2 years January. Not saying a chi and yes, share na cartilage, as I said, lumbar spondylosis and now setting in. So I told her say, and on mostly you use roughly 2 months, 3 months and correct Oni sa adaje no. It oba kumi no. One baby. Oba foforo no. Oba that was early last year. Oba not in wheelchair. When they came, and I made them, send me them family home. I'm there. When you come, I'm always there for you. Oba or then the reports and the when I took a look at the X-ray, when they said physio can't do anything about it.
I call extremity.
I call extreme. Or few say maybe because she came, I want anything, I'm angry, that's why I don't want to do it. And I'm so there, they should see another physio. So they're going to see another physio. I'm not so something unless surgery can correct the oil day or common. Once a cartilage in the same make what's now man really feel after the bone to bone I day. Eshia. Now and also I started day. Every then it's na create space in between. So space in the too wider. We can't do anything about it unless they fix a metal internal fixator at the shim. Send your bear a bit close gabalo.
Enti se yeka se za lumbar spondylosis na ho kan wasem na e cartilage is na ewe anas ayi a bone no ekwa ana yesen
ewe and also bone started we say and you making movements flexion of the spine, extension, blah blah blah, all those say say fancy it's a semi joint we say me kwam say ya pressure ni good cartilage ni so and the woman but say see and say cartilage no me kwam a bone to bone na ehia enti ade na etwitwi ni ho
na the pains ni ba no
na rere na kofom enti say kofom na no and a bit me do baby na degeneration setting in a limit physio can't do anything about it unless maybe they fix the metal, then we will come back again to work on it.
So what then any pains in the band pains and then at the back
pains and the movements I don't know if we a normal thing to the other way and the pain will set in. Pain will set in.
So abra I be feed the normal settings, and then the pain will set in.
Yes.
Oh, okay. So now we have known the activities. And then this is what Uncola, for some color bags, which and so your right posture will be okay, baba and important. So, Lambert spondylosis, in century minutes say. Pain be as much as any pain be any pain. It's a
Lambert spondylosis, that side, oti pain, especially. Omo finding it difficult, so omo be kwa omo. Find it hard, so omo be kwa omo. That's another thing. And your friend is saying, so what that we chicha. One thing I'm found my name say the kind of bed that we use, mattress I that so to me cause back pain. But we are mattress in the akum.
Okay.
Hey, it is a who mattress be sana was spondylosis. Now that's so bed sorry no. The pain will become
these things I've seen much on other platforms and other things. We say, and our bed and also say bed once market. We say your bed was ya hold them one a kum. We say na samba. And I was a spring room. And I was here when I was in school. We could toss some bed be more deep but head them high density pan can see a ground mem so how is those beds so different below?
Me, I'm not going to say this is a good bed or bad.
Okay.
What physio recommend is orthopedic bed.
Okay, so whenever the bed is orthopedic, the physio moves you to
for us. Orthopedic bed, any idea? Are you okay for us?
No, okay. Good, then we can continue.
Okay, so as I was saying, Ubisa say
maybe sir about the available who say spondylosis.
Ube was a wechi inka say like wechi oya. I know you're the major pain. Because so be anywhere, like me feeling pain, I'll go to the hospital unless there is a pain. So one thing is pain, or statistic of feeling pain, and not even call hospital. Aside that, there is nothing that can push that person to the hospital about that. So it's pain.
It is a what is I don't pay notice. Yeah, be then as a ubo pre-say when ya Lambert spondylosis in be.
And so that's what I'm saying. Okay. Come to our hospital. Let's do a proper assessment. To know so whether it's spondylosis, because there are some back pain do a fat lumbar ni muko fat thoracic. Inti you will be by your friend thoracolumbar spondylosis. Okay. That means thoracic no any lumbar ni can affected.
Eye collaboration.
Yes, inti no. We need to me deciding now say this is what I'm going through. Just come and we will decide. And I said the imaging aspect alone will decide what is actually wrong with you.
And okay. Although physiotherapists, you people work much on bones. And then although we have orthopedics people also, specialists who are orthopedics over there, who deal with the surgeries in the bones and other things. Are you people deal with the correction physically and other things about the correcting? Nipa chia. They said they are working and say pains number. What chia? Much me are correcting my.
Oh yeah, it's me correcting. When was it? The last time I came here, na make us say anything acute biano.
Mutu me share.
You bet me I be even the chronic we can do something about it, but be I yet me 100%. So what you say? But with acute, you bet me I am walk back to your normal now we see it. It's a baby chronic ha. We are too chronic. And before we chem, another thing too it's immediate waist pain ebano. Once na make up for posture. Obu how was some condition be to say lordosis meaning say we name what come here cause obu ha achacha and this animal and also to make cause it because and on getting the normal curvature of the spine.
And okay. Obi also ebe to me am say problem na na.
A lot.
Nti akasefo nso risk at risk. So which when we look at the general society, which people are at risk? Ni problem pan or at risk pan?
Say see I know. I'm more at risk. I'm one. Me want to say yeah, your office human.
Okay.
A lot of them because and you need the proper chair to sit on.
Okay.
And you need the proper chair to sit on. So those people are at risk. Aged people, they are also very much at risk of it. and all that. So we are all at risk.
No, okay. Because
First, and also I was talking, we assume say aged people not saying, but right now, because of our daily activities and it, we are all at risk.
I remembered some office be a mekoi. And I'm in 1 year. It's a very big facility. Na the Kumwa international and me a day. Kumwa said cherry. The one to say cherry and the international. For instance, if the nature of the worker, I can sit with me tenacity, then she do a film maintenance in Gina Hall. So which means a way pa. Wow, nice one. So fast forward down here twice on. It's what say science, no. I did here most especially say me pain na. Okay, pain. That's a menya pain no. Maba. Then I mean
Okay, so when you walk in, I say, Obeka so mechie me ya. The ben say, ye be bisa ejuma we.
Okay.
Ejuma we. And no bidding come my alert of the courses no.
So the course will depend on the kind of work that you are doing.
Yes. Ejuma we empower so akonya so this kind of verbal assessment any idea. It's ye share ya mouth report na wakakwe x-ray of the spine ni a share baby achimatono nti say you say we and ye wa the first thing but one thing is say x-ray no enye radio for pain relief we have to do it for you say na be ya no everything e be perform.
So how do you do the pain relief?
Pain relief, we have infrared.
Okay.
We have ultrasound. We have TENS, and we have heat modalities. We have shortwave. We have hot pack. And depending on you bet me, and I say make an verbal assessment. And you rate severity of your pain out from 0 to 10. It's depending on severity, and how severe it is, and then you be decided the kind of machine you be so
I'm a patient, Okay, so be an machine and use at the amount to more assess the patient on a scale of 0 to 10.
0 to 10.
Maybe over tunnel. So let me ask this example: what rate will be what scale of 5? Which type of a number is your
man? You be using TENS machine, near using hot pack.
Okay.
But say when the pain is like 9 or 10, we use infrared.
Oh, okay.
For that person.
Which is the higher the pains, the higher the machine can see patients. So how do you people correct these things?
All right. So after the pain, you elevate pain if you are, then exercise follows because we say. And a man will quiet and my problem. But I also you say, send your back to how it's easier. So exercise.
Exercise. Okay. Exercise. Okay. And Timo, who's there in our society? You will be. Yeah, mamma to me can say the hot na in theatre. Oh yes, back when Mamma Chinka say I lock it, me con. And to be frank, my baby. Na me tired pa say what's better how flat then obi a ni me rugro ja ti kokora te yes I gina so yi sa na mo ye na ha.
Seriously, I'm very much grateful of this question because idea ye nyina ni dey na ye repay so what you say is a no it's a no
madam because fish your for asema na mwese mka kire ya ho toye ya da ho
na obi ya ho toye ma e be no
obi da wetin tete ka cross agina do mi da kwasha ho
ni pani ya o feel relief acha 2 days so san be gina obi o we are sure say we are okay and concern bra bi o and no causes so many harm and damage to us after na ye passing through your friend is a result no. It's not okay. She was fine. You know what? Obi or me times 2 say me you know so. You don't need a health worker to tell you this. Oh, cool.
Ba o ti bra. Enti na mububu ala na mububu.
Another time I take bra bi na just check. But also we have chiropractor.
Okay. Yes, I know chiropractors.
like almost so yeah in a form, but I'm more professionals.
Doctors.
Obi how say make us an say na me try back pain no. Obi how o spine need to me twist it. So me to me yeah na aba si so kama then you are good to go then pain no.
Because I thought say I can see chiropractors this should be done by professionals. If you are not a profession, don't go and touch. You kill the patient. Chiropractor can crack. Obetuma crack your neck.
Yes.
Obetuma crack your chest.
Yes.
Which is very sensitive area. Oh, you're rough.
It's obi onye eyi koye ma wa.
But when you say can physio food day,
RIP in advance.
Good. Because you say so how do you people? What is the correct way? How do you
so say yenye chiropractor nti no me me chinchi mumu.
Okay.
Yenye method they say.
Okay.
We will do exercise.
Okay.
We have types of exercise for back pain. A specific one for lumbar spondylosis.
Okay.
A specific one for sciatica. A specific one for spondylolisthesis.
Okay.
It is all spondylosis. I will teach you an exercise concerning that.
Can you teach a small
one thing about back pain is a combined therapy.
Okay.
We do electro, we do education, we do exercise and lumbar support.
Okay.
Yeah, we belt
okay. The ambadi bo woman bi na na.
Actually, where you're designing as a spine or a form.
Okay.
On says nipa bia no matter kese away. There is a space be a wachi.
Yeah.
It's a design belt in that form, say and fill it that space. It's a what's not a chimpa pressure no a belt in the so.
Belt in the so.
That's one of the yeah. And another thing is exercise no. We have back stretches.
Okay.
To relieve pain. Your back stretches it really help you to relieve the pain. And then we have, as I said, electro to also relieve the pain. Then
the back, so before you go to what you're about to say, the back stretches, how what is that and how do you do it?
Hey, with the back stretches, we can make you lie down.
Okay.
Then ube elevate to upper part of the body.
What down flat?
Down flat as in posterior angle.
Okay.
When ebeto a form now the on says to see what picture also. And mostly we do that for more multi pain or waist line. But one thing is that before we will give you that exercise, you see you the way spine no SCI. So for yes, exercising a brow spine no I that position that. Oh, we're saying
you are worsening it.
And don't do that exercise because you heard a physiotherapist talking about it.
Okay.
Before we will give you that exercise, no, now spine no. I say.
Okay.
And this exercise is to help you correct it back. So that's one of the exercises. For and we have this exercise that you have to sit down. Now we try so about forehead attaching your knee to strengthen.
Sir, it makes what say.
You sit on the floor.
Now my trim
yes, you be straighten your legs.
Now mama way me ha abeka me ha.
You'll be able to
because mean to me, yeah, it's not mean to me.
But you are not forced to let your forehead touch your knee. But do a bit in your core. Or do a bit in your credit say. They're not quite challenging a man because your friend is saying, until me drew that like that's the only level that obit me do. And maybe for instance, I can do it for me. No, make me a problem.
Me just say what birthday. As I will try. What mama try? No, I try to walk coach me. Wow. Okay. Viewers, we are learning a lot. And on exercise now, and exercise be an exercise. Your exercise. And your maybe how body look okay. If you don't get the right person to teach you what about you, but you try your bar, Okay, example wakwa aba zone 5 health line so and then you share the you come deeper ade a won tia se na daily activities a to me akoso wo ham no and na ye hama on no and then the physiotherapist Portia amo and na ye no atwetwe enkomo no ye kasa about back pain, lumbar spondylosis and waist pain. Those pains, you know, and then and the ye no and then ya chere science activities are able to me across so that any diagnosis and how it is being done, the kind of exercise are BBI ready, get it correct no and no and so na you do know. Before I go break, you know I can about exercise, you know.
Yeah. Then I make sure no. I thought what's a form now I try so do mama. I be good. And also ne idea back. And I make us say the other mean pinpoint the kind of exercise and they say ejina pain ni so.
Okay.
Nti ever say so do ho about say o ten one ha. So if you are doing stretching, maybe I will stretch it up to a side no with maybe there's support from the physiotherapist. It's not me finding out how to pinpoint the kind of exercise because it's not say a show diagnosis near designing treatment for you. We can't just go ahead and like do anything for you like that.
Oh, okay. Yes. Okay, so you can't just sit down and just do something. You have a specific thing. I say, visiting the physiotherapist, not sure the right thing to be done. So how is the duration and how many years and a month and a days they do before that person also available to me one?
For acute stages, no, roughly a man is 6 weeks, which is 1 month.
Okay.
2 weeks. Same pose and cochrana, also 80% of improvement.
No, okay.
And that's for the acute stages. And back chronic, you know, bear 3 months, 4 months. So you do 3 months, 4 months, me achieving what we want to achieve, but then we'll continue from there. Until we see total improvement. So, say for worst cases, what would you do? Your worst part, we manage. More manage, want to mean correcting the bill. Yes, it drew a point. Maybe surgery can correct it.
Okay.
And to say we allow the surgeons to do their work. The after that, then we will set in.
And say call West, then you give it to the orthopedics.
That part,
oh yeah, no one take you over from there. Oh, okay. And then what can I say me? Is young colline I have parking books near the Gumwech, you know, and then offices. So what is the right thing to be done?
Okay, so for a prescribed chair for an office person, ergonomic chair, you can Google about it. Ergonomic. And on my end to say. Meaning, some kind of C or say S shape to support the spine, and only a chair, and it has a back support and also a spine support. So, and these things, these indications, maintain baby. Is it like physiotherapy? More, is it yeah broad no be offices? Yeah, check it and I'm what checking. Yeah, my normal circumstances. No, it was any in your physio. We don't only need a physio at the hospital basis. I was say company be our one physio. So what I say, I obey and you may be a more money day. And I say, okay, footballers, they have their own physiotherapists. Okay. Okay, playing a physio is there, like all the fields. Soldier form physio, they are there because they know how important we are. And I was say every facility they have to get a physiotherapist. There, send a bit more education, and in case will be a problem, the person will be there to assist that person.
Okay, then in Kolana school, then what's the right? Then 1 year.
It's not bad for you to carry a backpack, and that's all baby back. But a day no book now, like subjects now or the courses that you have that particular day. For a home book, or how a packing it day and Monday to Friday. Maybe I'm saying go. Send a baby with fear. For the whole week. So carry the one day bet me there. Afa. And say a backpacker and you know kwa. Obi on so ne bag near the sign in Saho. It will both any penny baby no what you say.
One handbag, you know.
Was what you say. It's the right thing to do is bono one bear 10 minutes to her. Waji, no baby bono, bear 10 minutes. So
what the bag this 10 minutes kakra. What say yaba? That is the right thing to be done. Oh, okay. Anna, what about the bed?
Bed, you know, go for orthopedic mattress. Oh, that bed is so. Nasa would them. Nasa finfi a woman. Please. it's not advisable. And I say it's not advised. Compare for free. And now, in case you are using a chair, obi oha, I was say oh compromise it, and I say because ejumano waka they are not giving you a new chair. It's either you stop the work or you help yourself with a pillow. What's nasia? What the pillow? A cover space na what chino. Send a beya betini a leaning on it.
So what now? Even when you are driving, now we see it is over to me the pillow now.
Yeah, recently they brought something and they took her seat so opebia. You can contact us and we can get you some. Or the best show with chi until you drive here, you feel comfortable. It will stay and let you send a beya bapping, especially truck drivers, normal driving for long journey needs that, those people they really need it.
Okay. If you need some, you can contact her. Now when you're sabi or driving for longer. Now there are 2 seats so fair. Said you beya unya problem here with your spine. Oh, okay. So what try a feeling you Mr. Mejimia, what was the one who pretend that but to mama menya sa problem?
A lot, of course. Like Obioha, a person will build the fast in it, carry weight a bro, na who the one personal strength, so and also once I make catch us and make us and make catch us put pressure on the spine. And it does on my year peja koshua. You are putting pressure on the spine, which I have a client I'm treating right now because of that.
Of that one, yes. Okay. And then let me ask this question. We are doing the questions now. Me the for adwin munsem and I'm ready to do. Who say what can say? What I can say? Obi a wo share health it may affect your spine no correct.
And you say it may affect your spine. It all comes back to abnormal posture. We are like this. I was say until like this. We were created like this. And also chest heel now, especially the one as a sound. A pull you go forward. Not why you see. So what do you expect? It all comes to that. What's the sound posture? And I also can say a causing back pain and waist pain. A poor posture. It is also heel as a sound posture now. At the end, and I say at the long run, it comes to back pain. It's and also a one factor and also a high.
So then is watch them collide and say want it loaded so. And the obesity no fan call. And I was answering say bag no. Watch them start your more bag no. You more 10 minutes to her. 5 minutes to her. You have a book a crown so her. Obo wakra any adwuma pa na obo akra wa na ekugwa no so akire say ergonomic chairs in panas wa akire orthopedics and then bio obo pregnancy so obi nyem how ben onante kwame so no
there is nothing that we can do when it comes to pregnancy.
Okay.
Because Nipano she's going through a lot. Okay. It's oh mommy tinumo oh few.
Oh, few. Okay.
Because she's doing what she will feel comfortable. It's after all opposite birth area, that's when we will come in to correct that. So on your party, or your day on you.
Oh, okay. And then let me ask you, can we have diet? Diet be a baby to me a problem now.
Oh, for now, no, I can't.
You can't tell about that one.
About that one.
No, okay, and then. Say obi tietia no so na ana wo say wa kubi so obbo mi mu obi to obbo mu bu ti say no be bobbo.
It's not good, it's not advisable for us to do that. Yes.
Na ba kubo so ye mo bo ba emiamia kakra say o miamia nice one be ode so wa she. Oh madam eni je ho obi ode so wa she fine o mia tawa na ode so wa she ode to achi.
Oh, and no, there is nothing wrong with it. Okay. It's so share part no. Okay. But unim de yeni pana ode so share air ton so. Because physio we do ice and cold, we do cold therapy and we do hot therapy. So when we say dintina eto wa you using so share. Dintina eto wa you using so you know. Unim. So don't assume and do things because what we say will be in consultation. Also, when I was talking about the pain partner, I spoke about hot pack and no you boom so you some pack near there two each. So and there is nothing wrong with it. If you know what is wrong with you there, you can go ahead and do it. But if you don't know what is wrong with you, please just find out what is wrong with you before you do that therapy.
And then this is not a topic that we are discussing, but I'm say different. Even you are discussing on it. It's a menstrual pain. Yemi anamoma menstrual pain. So ono so wa wetumi de inso ohye bibi atoto wachi na akọ and so advisable na.
Oh yes, we all do that.
Okay.
Then make kind of the hot pack helps with pain relief. So feeling pain na ultimate the two. Then relieve pain no kakra amount.
Now, and where does the cold pack say me the blog and so about one infant?
And no, when the thing is acute, we use cold when the situation is acute. When it's acute and there is a swelling, that's when we use cold. Fastest pain relief. Meaning so what's the dia feel the so footballers so be pra you use hot pack or cold yeah the block the can the better so when it's acute, when it's an immediate thing, that's when we use cold.
And then do we have first aid and a simple way as we feel before I'm about hospital no say maybe you be me be bu ni name me ba me won say wakobo fem you be am here no before me ne beba mo ho ana
no say make can say open wound e wo ho dia me pa cho leave it come to the hospital.
Okay.
When you open wound no one who say ahono kakra obetime the ice kakra bi atoto so for like 2 minutes bi kakra atoto so and me I am like first aid concerning physio I am be very careful when I'm giving education about that because even in school tea no kwakwa ye de your sister way and say physio ni we ne can say me koye na the problem so we put problem na say a physio time na let me deliver na ba bring the person and post any physio timer when you send the person to the hospital the doctors have small knowledge about our work so they will do that then the next day we will come and take over. Because it's not like until you work out for para. Before somebody will have a condition that's a physio issue, that means there is a problem within the bone. A bone thing so dear. I don't know so what's a massive bone thing idea and yet para and I'll be no ama ebeko. Go to the hospital. My doctor and mom say first aid, and I only first aid in there. And I'll say you need one the next day because physio no. Small facilities been there working 24 hours. All the most of the facilities, ya chana 2, ya cha 3 p.m. ya home. It is so few that this thing can happen after 3 p.m. Now to me physio. See the doctor. The doctor will do something small about it. The next day will come and take over, and will take care of your child.
Na so wo so ni sisi en yawa o hwe ni sisi kose ma twen akose ma twen abase ma twen akose sa me ho atome anu anan mun say no so ye one of here ya tai e wo fi pa we de na min chipo we na min sign emisa obi about say spondylosis we na ye echi na lumba no na space abeda ho na e bibia no prevention them pa because they we asking aba them pa wa chechere bi nyama yenye ene ade ba ye wo mejo bi ti nyama bi betumi aya betumi asiri ade we anokora na
making sure
say dro bi wo ho ana bi bet mi ne yemmo
belt no also I was talking about lumbar corset lumbar corset when you have a problem.
Okay,
you can put it on when you don't have a problem send be protect it back from any injury, especially when we lifted at the end those times. And assuming a correct posture, and also very good. And another thing is, say, cartilage in area, we support it with a supplement.
Oh, okay.
A supplement that has glucosamine in it.
Glucosamine. Oh,
yes.
okay.
So rebuild the cartilage, back. And not try say, glucosamine, a drobia. The correct one.
So if you need the correct food supplement, then you can contact the physiotherapist so that you can get the food supplement and then support.
Anything that has glucosamine in it, grow back the cartilage.
Oh, okay. So, Portia, do you have anything? Yeja ewo pains in my young Kawasamana. Here in you are young Kawasamana.
For now, I think said the here the major part me I hate on it and I know that for first I baby will say bibi o ha you jam ma ye nkosa akwa ye bebo so say na be ya ye tie fo no and so be tie no account
which means say the pains na ekoso nyina no mo wo account ya so ni pa akone ba motuma aboa no e ma akọ
me pa cho
100%.
Obu ho de na enye 100% because and na ebe kon so ejina patient me so enye one day job it's ba wonya saa into boasie no ana abotere no now to me fa process ni munyina na I can assure you of your healing but obi ho ba ne on ba bio eje ne kan ba ko no asamba
bio ti physio for what abotere ene aye ho adwuma ene ade nyinara so I think what shia ade pa about pains and pains you know and then one of the things that in society in your painkillers or pain no akofa painkiller and now call ochna assign by day in advisable go to them any pain be go to them when the right thing to be done. Wow, what a very nice education. Nah, Mr. Portia, what am I here no? What my advice? I try. Do you have anything else or your final words to your viewers before we go?
Alright, so the people watching me know. Physio, we do home services for people.
Okay.
And yes, obi oha because of my schedules, just take our number, call us. We attend to you. The we can do it home and also pa obetini abaye home.
No, okay, then why don't we number to
okay, so if you want my service, my number is 0249 64 5487 0249 64 5487. You can call at any time except midnight. Thank you.
Except midnight. Where the physiotherapist any di enkomo no. The din Portia Amo. Where the yadase. Sir, uji pene any Zoom 5 health line. Etwetwen enkomo. Yesua bi pa. Yane kloni nya ne atwefo nyina. Yese yada wase. Yo, where the your sister Portia Amo physiotherapist ana ye ne no etena se edidi enkomo no. Ye je ni se wo hwea de ye pa ba lumbar spondylosis, chest pain, waist pain, particularly pains nyina. Whenever you feel any pain, don't hesitate to visit the physiotherapist. Kwanchan na obechiro the right thing and how to manage it. Enti mentena fie na wankasa uma wankasa ho diagnosis. No, never do that. Never do self-diagnosis. The service and the contact no dey ato no. So here we be na betumi a contact no. And the that say oje pene enya abotre edi echi ehua ade share ade we ma wunua unu nyina embom ntenas na munhua ade daily activities where your common mistakes are they be ye your life e de ohaw any amane nyama ensem patan ebetumi prevent e ba yen enti de nya abotre akofa wona wonim de e wa apomudi nsem abetena ase ye singunwa akyerechire mu ma wate ase and as the daily sponsor wo hwea nti fama wunua una busho bi biara na nya abotre e ma ye apomuden wonsem ehia ye pa Mosomfo Richmond Tete ena metena ase me ne physiotherapist Portia Amo etena ase didi saa enkomo no me ena me di dwumadi nyina ho twea me da ase se woje pene ehwe ye me biara owo biara no rade nhiraw obetumi so adi achi ewo Zone 5 TV Zone 5 TV ewo Instagram Zone 5 TV Instagram Zone 5 TV ewo TikTok and so the same with Facebook Zone 5 Media GH Zone 5 Media GH. You can like us and follow us. Oko YouTube we share Zone 5 Television. One nyama ye nyina be hu ho Zone 5 Television. Be hu dwumadi different one ye nyinara. Na dia ye atwam the past episode and incoming ones nyina. Benye be Zone 5 Television. Zone ye ZONE 5 Television. Be you subscribe, you like and you share to your brother to impact others. You can visit that at our website www.zone5mediagh.com www.zone5mediagh.com. That's it. Sabi biara no unya botre eni yan esinkwa. Se medi kan catch medi ane Richmond Tete. Me na medi dwumadi ho chance. I'm your host for Zone 5 Healthline. And many thanks to my production manager. Kojo Edu Asare. Radi Isiran Kojo Edu Asare. That is my production manager. My director Owusu. Mr. Owusu Yesu Nshirapa. The executive producer of the show. Mr. Prince Ajay. Fitisoro be kan from nyina sinabeti our welfare Madam Evelyn production assistant Mr. Caleb Cranton IT head of IT Jason baby Arobi already Nshiraw and other directors and also producers are more out there nyina no Mr. Adomako Mr. Bafo nyina Yesu Kristo Nshiraw nyina crew members and one so what they have the manager of Sweet Roses and the workers of Sweet Roses be. And so already insure mo say onya botre na bibiala no onya botre na mo service na mo mayen kwanya e ma yetwa yendumedi no e wo ha. Already insure mo da sende e be hia makraw. Bye bye.